Okay, this is a very short video to unpack some of what I alluded to in the last video on the positioning fundamentals. You know, why you can't market your research your way to a positioning, and it was to this video is about unpacking those words efficacy and safety, because some people say, well, you know, what do you mean by banning those words? There's very good reason to do that, and hopefully this short video, aiming at 5 minutes, will give you some hint about why it helps and why they are misleading as ideas within the positioning process and actually any path to market. So we need to think about positioning or about those words the way that we do. At a macro level, efficacy means something. So your antidepressant has efficacy. What kind of efficacy are we talking about here? And it's that specific that we want to get into, because if you can use the word efficacy, you believe that you're communicating the same thing to the person that you're talking to. But what if their definition of efficacy is effect on outcomes, or its effect on motivation, or its effect on attitude or behavior or mood or sadness? What happens if that definition of efficacy attaches to how that works in specific patient populations, or gets written into labels? You can't just take efficacy and assume that those dimensions all come along with your product. And that really reveals one of the opportunities. Because as soon as you start to take, let's say a Parkinson's drug, and you say, well, do you have an effect on tremor? Do you have an effect on disease progression? Do you have an effect on myelination, or whatever it is in that disease that your drug might have an impact on? And then somebody says, well, I just want more efficacy. Well, which of those things do you want? Do you want disease progression, or do you want symptomatology? Take, say, rheumatoid arthritis as a fantastic example where people say that they want more efficacy. Okay, well, which efficacy do you mean? Do you mean impact on symptoms? Do you mean impact on progression? Do you mean impact on damage? Do you mean impact on... And you'll start to see why, when I hear the word efficacy, and folks at IDEA are trained to, when they hear the word efficacy, to say, well, what do you mean by that? Because it's in the specifics that both the competition play, and it's in the specifics that you have to play. And it might be that your product isn't going to compete efficacy for efficacy with another product that already claims it. Let's say that Enbrel is already out there in the RA space owning efficacy, or Humira is. What if your drug does something different? Are you going to go head to head on the dimensions that they're best at, or are you going to find something that your drug does that they don't? And that might be about progression. It might be about prevention of disease modification, actually, in that space. So you start to see why the word itself is meaningless. And it's meaningless to us because you can't use it, you can't talk about it. And it's also useless when in market research somebody says, well, if you just give me more efficacy, or you go, well, of course you want more efficacy. Well, which kind? Which part of that particular chain is it that you want? And you can see, and I'll draw this quickly. If you've got let's see if this is going to be visible. If you've got the traditional kind of, minus to plus, everyone wants to essentially just position themselves further along this course. And let's say this is depression, and you take mood as an example. So we're going to have more effect on mood than the other guys do. But what if that's not all that matters when it comes to depression? It might be that you've got another axis of motivation. It might be another axis of energy and fatigue and so forth. These axes are going to matter when it comes to positioning your drug, because if you're just going to say we've got more mood-based efficacy than the other guys, that's fine if you do. But what if you have an impact on some of the other things that people really want when it comes to specific patient personas, specific patient types? And this is going to matter. Same thing obviously applies when it comes to tolerability and safety. People talk about words like convenience, and they pass into things like patient preference and physician preference, and is it actually more convenient, or does it just seem more convenient because it's once a day? So those words that exist at that macro level, efficacy, safety, tolerability, convenience, preference, they all unpack, and it's in the unpacking, it's in the parsing of those macro level words that you define opportunity, because what your drug does may be what is currently viewed as the standard of efficacy. But what if your drug does something different, which I hope it does? you're bringing something new to market. If you go on the old traditional measures of efficacy, let's say it's a pain drug, you're going to go on, the old standards of pain clearance. Well, what if your drug does something different than that? The problem that we see is that a lot of research tends to end up in that view of, well, if you ask physicians, they'll just say, give me more efficacy, give me more safety. So you end up with this, they want both. So you end up with this balance of safety and efficacy, which just drives me crazy when I see it, because it means nothing on either side. And then you end up with this balance, which frankly is nonsense. But then you get into, as soon as you understand it the way that you do now, which is this kind of, efficacy passes into the different dimensions, safety does too, so does tolerability. You can't have a balance of all of those things. That sounds, that's either utopia or it's kind of meaningless. And that's the biggest problem, is that they end up being overused, meaningless words that you want to come back and do something meaningful with your positioning. You want to create a space in the mind of the physician. Do it with specificity, not with kind of, nice words that we all accept, but we shouldn't really when it comes to something that's meaningful, as positioning something for patients. Patients don't use the word efficacy, they say it does something. And that's the test of positioning, is, what does your drug do? It does this. You can't just say it does efficacy, because it sounds ridiculous. Well, that's how ridiculous it sounds when you think about it in this way. So that was all this video was about, was just really about explaining, why maybe I get too frustrated with that idea when people stop at the word efficacy and they don't think there's any more work to do. But also really where the opportunity is to think differently about it and to make it mean something for your physicians, for your patients, and ideally for the payers who are going to make the choice about whether those two people can have what they want. So thank you. We'll cover some of the other questions that came from last week in a couple more videos time.